Welcome back to Leadership Rediscovered with Laura Siebold. This episode is a continuation of last week's episode. So if you haven't listened to that one yet, we suggest you go back and listen to part 1.
So I'm curious because, again, and why I asked you how you got into the world that you did in terms of your career choice is that I do feel like a lot of times a friend of mine, Greg Clutter, says you can't be it if you can't see it. And so we do sometimes end up in careers or fields based on what we're aware of is even out there. So I came from a family of engineers and teachers. And so the whole, public health, public policy, health administration, that world to me is a big question mark. And I know there's a lot of people that are going into that as in their college majors and things like that. But could you just give us a window into what is a day in the life like for you? What are the things that you're doing?
Yeah, well, I think there are very different days in the life depending on what you're doing.
Yes.
So whether you're kind of on the hospital side, physician practice management, or on the university side, I honestly think that leadership is leadership. And I think that once you have management skills, you can apply them to anything.
Yeah.
So there are some places you'll go in a hospital where they think, oh, you have to have a clinical background, or you... I honestly don't believe that.
Yeah.
I think that managing people, having empathy, making them feel that they're being listened to, treating people fairly, being transparent. I don't think that matters where you are. And so even though the university was a big adjustment for me over being in a hospital, I remember it was probably like a month or two of sitting at my desk where I was just unnerved by the quiet. I was waiting for some surgeon to burst in my office and be screaming about something. And if any of them are
alarms going on.
If any of them are listening, they know who they are. About a piece of equipment being broken in the OR, something didn't work the way they wanted it to. And you got to stop everything you're doing, and you got to deal with that right then. And so then you're not getting anything done during the day, even though I tell the students that want to go into hospital administration, I say, but that's the most valuable time you can spend. Because showing them that you're listening.
Yes.
You have 1,800 people under you or whatever, showing them that you're listening. So if I walk around and a tech, from the OR, you got to get out. If you don't get out, you're not going to hear the problems. So you go out and a tech from the OR says, there's a safety hazard in the OR. It's been reported, 5 million times. Nobody's coming to look at it. And you could just say, okay, well, I'll talk to facilities. Or you could go put on scrubs and go in the OR, let them show you.
And see.
And then go and get facilities. And I mean, especially if you assess, gosh, this is a real safety problem. This door could fall off and hurt somebody. And I think you gain respect when you do that.
You do. And I'm so glad that you brought that up, because I go into organizations a lot to do leadership training. And that is a common complaint I will get, especially from a mid-level or frontline supervisor type role within an organization, is senior management is never present on the floor. They are so disconnected from the work that actually gets done. And it has all types of impacts, one of which is being decisions that are made. We're going to implement a new system, but we're not going to talk to the people who are actually going to use the system.
Correct. Yes.
Or we're going to change. I mean, so many decisions that are made that impact the end user, the worker, and they're not discussed with them ahead of time. And there's also that component of they don't understand what our life is like. They don't understand what we're going through. And we're the ones, a lot of times the perception is we're the ones doing the work here. We're the ones that are keeping the lights on here. But nobody's taking the time. And I get the flip side of that from a leader perspective. It's a lot of meetings all day long. It's it's not that they don't want to be on the floor necessarily, but it's just hard sometimes for them to make the time to be there. But
you have to make it a priority.
Yeah.
And how do you understand how to fix the problems if you haven't been out there and actually seen it?
Yes.
And I learned that kind of from on the job. When I was in college, I got lucky. I got to do an internship in London at a hospital for a semester. And the way they structured the internship was I worked a week in every single department. And I mean every department. So I answered the switchboard. There was actually a switchboard. Kind of scary. I cleaned rooms for a week. I wore a housekeeping uniform. I cleaned the rooms. I was in the kitchen for a week. They kind of had me off to the back when they realized I couldn't do anything.
Cereal. Do you have cereal here?
Do you want me to pour the cereal into the bowl? But it was good because I saw what problems other departments were having. So if the ER can't get beds up on the floor to get the patients up, then you're like mad at the floor because you think like, why aren't you telling me there's a bed ready? Yes. And you run up to the floor and you're like, oh, well, housekeeping hasn't come to clean the room and turn it over. Then you go find housekeeping and then you find out that they're short-staffed or whatever, or they're missing a important piece of equipment that's been broken.
Right.
But how do you put that process together if you've never gone out and seen it?
Yes.
And I think the other mistake people do, and you've probably seen this when you go into organizations, is people will say, well, I do leadership rounding. I go out and I round. But what they do is they just walk, like they beeline through the floors.
Yes.
Like they go up on the hospital floors and they literally do a lap and they're out. They don't talk to anybody. Or they say like, hi, and they keep going.
Yes.
So it's uncomfortable sometimes because you are an outsider in someone else's world and they're a little bit skeptical of why you're there at first.
Of course, yes.
But you sit down and, you don't want to make them stop doing their work because they're also like, I'm really busy. Like, I don't have time to sit and talk to you.
Yeah. But, I mean, just being a part of the woodwork and just observing what's going on. You don't even have to talk that much because it's not about you. It's about learning. And so turning on the listening ears and really just observing and paying attention and then being able to ask maybe a few questions just to what are the problems that you're dealing with. But it's not, you're not there to check a box of how great of a leader I am. It's I'm here to solve problems and make things better for the people who are doing very important work.
And so I think because you do a lot of executive coaching, and I think trying to get people to understand the difference between rounding and effective listening is huge.
Yes.
I mean, it really, really is. And just, and how many times, and this is just in everyday life, does someone walk by you in the hallway and say, hey, how are you? But they keep going. Because the majority of the time you probably said, good. But what if you actually said, like, I'm having the worst day ever?
Yes.
Would that person stop and say, like, oh my gosh, Laura, what's going on?
Yeah.
They should.
Yeah.
But most of the time they're way
They're
past
like,
and they have no idea. Yeah. Yeah. It's like
Good
when
to see you.
Yeah. It's like I'm having this talk with my child and then I realize under her hair she has AirPods in and she's walking away and I'm like, great talk. Like that was a really good conversation we had. But
no, but it's so true.
Yeah,
I've actually heard that as a test, like telling people, try it out sometime, go through your day. And when someone asks how you are, hey, how's it going? Just say something like, terrible.
Yeah.
Or I'm
like,
so sad
my dog
today.
died.
Yeah. It's just
funny, but something just to see if they're going to
just to see if they're listening.
Right. Because so many people think that's management.
Yes.
And it's not. It's like checking something off of a box.
So much of checking off a box. And I think it's the motivation when you talk about service above self. To me, that is leadership because then it's thinking about, why am I in this role in the first place? Is it about me or is it about the team? Is it about the people I'm here to serve?
Right.
And so checking your motivations on everything you're doing against that. If I'm going on the floor, am I doing that for me to make myself look good and to make myself feel important that like I've taken time out of my very busy meeting schedule to be here? Or is it truly about I genuinely want to know?
And you're already an outsider walking up on a clinical floor with your suit on, but to not really have empathy and listen and think about what they're saying, and it makes a difference. And sometimes there's a real problem going on out there, a real culture problem. And you're not going to know because you weren't out there, because they're not going to walk up to the administrative suite or the C-suite and ask at the desk to see you. Some people do. Yeah. Not many do, though. And I think, it's people say this all the time, but culture eats strategy every single day. Yes. Culture eats strategy for lunch every day.
Every day.
And I think that that's where you find out what the culture is like. Yes. Because if people are out there complaining, or, there's sometimes negative Nancy in the hallway chatting about things. And sometimes maybe she just wants to be heard.
Absolutely.
I love sometimes when I'm up, like, rounding, and I just sit there and listen. Yeah. And then later, people are like, thank you. You really get it. And you're thinking in your head, like, I didn't do anything.
No,
I just
it's really not that hard.
I just listened. But people are like, wow, she really gets it.
Yes.
But somehow it made them feel better that you were listening.
Absolutely. Because it does feel good to know that someone, it shows that you care. Hey, I'm curious to hear what you have to say. You matter to me. I see you. I hear you. And you belong here. I mean, that's all the messaging that's tied into that. And it's so huge.
And I think that if you're not willing to do what you're asking other people to do, we talked about this a little bit. We talked about it earlier with off camera when we were with the hybrid talk.
Yeah.
Then people aren't going to respect you.
No.
And so part of my management style is to do that, almost to the point where, when I managed clinics, there was a call center. And we do all these phone stats about how many calls went unanswered and how long the average call is. And sometimes if there was a long wait time, I had it routed to my phone and I would pick up. And I think the call room people kind of became funny when we went through the stats because they'd be like, okay, Sarah's killing our stats because she doesn't know anything about what we do. And she's like taking 15 minutes on a call. And I'm like, how about the fact that I'm helping?
Yes.
But they respect that you are trying.
Yes.
And so
they see that.
They do.
Yeah.
And they see if you're walking through the waiting room and you lean down and pick up a piece of trash. I don't really want to pick up that trash. It looks gross, but somebody has to pick it up.
Yeah.
So I can go pick it up and go wash my hands.
And they see that.
And I expect other people to do that then.
Yeah. Instead of, hey, facilities, you need to go pick up this trash.
Yeah, well, that's not my job.
No. Well, and it makes me think of that show, Undercover Boss, which I love that show.
Yes.
And I can't tell you how many times I'll go into an organization and I'll think, ooh, they need to undercover boss themselves. Right. And you don't need a show. You don't need to be on a show to do it. But really to find out, because culture's not words on the wall.
Right.
And until you actually dive down all the way to whatever the lowest level is of the organization and spend some time there and everywhere else in the organization to learn what is the real culture here, because it's not what's on the website necessarily or on the walls.
It's a great idea if you can pull it off. Part of the problem with doing so many things in the community is everybody knows me now. Right. And that can be good or that can be bad. Yeah. But one of my jobs in Chicago, when I was going in as the administrative director for their cancer institute, I went to the hematology oncology clinic that day. And I sat in the waiting room, and nobody knew me. I was there for 4 hours, and that was fine because I was like working and taking notes and whatever. But I could hear all the chatter behind the front desk. I could hear them, coming out, and it was some bad stuff. I mean, coming out and calling names like with their file, and then literally, this really happened. This woman, this medical assistant, whatever, was trying to call a name, and it was a hard one to pronounce. She leans down to somebody sitting in the waiting room, and she goes, how would you pronounce that name? Okay, so forget HIPAA.
I was just going to say, HIPAA.
Yeah, I was literally having a heart attack, but I didn't say anything. Also, the fact that I sat there for 4 hours and no one came over to say, like,
nobody acknowledged
hey, did you check in?
Wow.
So we had a lot of work to do, but they were all really good people.
Yes, good intent.
Yeah.
Everyone's trying to do a good job. It's just wires get crossed and priorities aren't aligned, and people get distracted from the things that are the most important and matter most.
Very good people with very good intentions, and they want to do the right thing. And I also think that you find out, because you see a lot on social media, you find out that your employees, I think, talk better about you when you're not around, not just you, but the organization. Yes. So I want people to be empowered.
Right.
I don't want the phones to only get answered when I'm standing there watching everybody answering the phones. I want people to answer the phones and do their very best to help somebody. Yes. I went to a Ritz-Carlton training once in Chicago on customer service, and that is like the Cadillac of, I mean, it's very interesting, but they have this philosophy where if a customer comes up and asks you for directions, you cannot just point. You can't say, okay, go down that hallway, take a right, and get the elevator. You have to walk them.
Yes.
And so I try really hard to do that. I will say it's very hard sometimes when you're really in a hurry. And the health sciences is a big connected building, and I don't even know my way back sometimes. But, even if you don't know, that you could go with them and help them figure it out. And people are very appreciative.
Well, and the other thing is you never know. It's sometimes those small moments in a day that you could really have made a positive impact in that person's life. And I think sometimes, again, going back to good people, good motivations, good intention and all that, I think there are a lot of people in this world who want to do good things, but they think it has to be a really big thing.
Yeah.
And it's not always serving as the president of a board.
Right.
It can be taking 5 minutes to walk someone to where they're going because you just alleviated stress for them. And maybe they just had a cancer diagnosis, or maybe you just don't know what's going on, right? And you could have just totally made a huge difference in that person's life.
And I think being able to explain that to people who get upset about something too that work for you is important.
Yeah.
That perfect example that you just gave in the cancer center, I remember having to sit down with a staff member who was upset because a patient was yelling at her. And I kind of sat her down and I said, well, okay, it was like the 3rd of July weekend. And in downtown Chicago, it's fireworks, it's insanity. There's millions of people, so traffic stinks. And you got to go down there. You're paying $20 for parking, which is the patient parking price. That's not, whatever. So I'm like, and they had traveled from a couple hours away. And we messed up their appointment. So really, I understand that you don't feel like you should be treated that way. And I'm not saying you should be treated that way or that that person had a right to say those things. But also step back and imagine if it were you or it were your parent.
Yes.
That you were dealing with that, and just kind of put yourself in their shoes. And sometimes you can't make everybody happy. But you can listen and try to have empathy.
Well, I was just going to say, this is empathy. And I love talking to you about empathy because I know that's something that you are strong in, but sometimes don't seem to want to claim.
Well, I think I told you, didn't I, when we first met, I said the university had this thing where you could do the strength finders. And I did it. And I got my 5 top strengths, and I literally felt like I failed. I know you can't fail the strength finders.
No, you can't.
But from a business perspective and somebody who thinks like I run things or I manage things or I lead people, none of it was strategic or
achiever, competition.
Yes, it
command.
It was harmony, relator, empathy. And I was like, no wonder I'm exhausted at the end of the day. Seriously, I care. There's so many feelings involved in managing people.
Yes, there are.
And sometimes, I am pretty good about sitting and trying to understand what's happening, why you're not happy and why things aren't going well. But sometimes it just goes back to the fact that you're not going to make people happy. And people don't like to hear that.
No.
I say it goes back to my waitressing days in college, where I felt like if I could turn around 95% of the people who end up being happy, I can turn it around because somebody gave me the autonomy to be able to comp something on their bill or do something. I feel like I did a good job because there's just certain people that you're not going to make happy.
No.
And sometimes you're like, okay, you kind of have to figure out what's going on with you.
Yeah. Is this a me issue or a you issue?
Yeah. We do that all the time in our personal lives. But I'm thinking that you need to kind of reevaluate. So, but yes, empathy is a big one. But I really did feel like I failed. And then I went through this Clifton Strength Finders thing where basically the point of it, and I always have to remind myself of this, is to figure out how to take those strengths and capitalize on them and use them for good, for the good in what you do. And the other thing is knowing who should be on your team.
Absolutely.
Yeah. So I'm also not a detail-oriented person in managing, not at home. At home, I'm pretty anal about everything. Whatever. I try to be.
Yeah.
I've kind of lost the fight many times with kids.
Right.
But knowing who's around you. So I make sure I have the best finance person and the best person to do marketing because those are the experts. I'm also not going to say I take the credit for what they did.
Right.
Because you're only as good as the team that you have.
You absolutely are. And you brought up something earlier about just thinking from a leadership perspective, whether you have that background or not. And sometimes I think it actually helps you to not necessarily have the background, to not be a former chief marketing officer now trying to manage your head of marketing. But to be just lead.
Right.
And you don't have to be an expert in all those fields. So number one, you don't have to have the technical acumen that they do. But number two, absolutely, if you can also find people from a personality or strengths perspective that balance you out, then that is a winning team.
It is. It's a very, very winning team. And yes, like our business office person, if I really trust her, and she's very good. She's an accountant by background. And if she says the numbers are right or this is the right thing to do, then I do it.
Yeah.
And I think that's part of it as well, that you have to give people the license to act and to make decisions, but you also have to give them the license to fail.
Yes.
And not necessarily make it a punishment.
Yes.
I mean, I think you learn from your mistakes, but we so often have this like risk averse management,
especially
style.
in healthcare.
Yeah. Yeah.
I feel
yes.
like
there are different levels of when you've made a mistake. But when a mistake happens, own it.
Yeah.
And go back and look at what happened and what went wrong
from it,
so that it doesn't happen again.
Yeah, absolutely.
Yeah, I agree, because I think that's the way to do it. I mean, I'll be the first to say, oh, wow, I forgot that email was in my inbox. You know, when you ask me why I don't respond, and I'm like, well, I have a screen this big.
Yeah.
And when the emails keep coming and it goes below the screen,
poof.
Yeah, I'm like, it's gone.
It's gone.
Totally gone.
Oh, I'm the worst. And then I get like so upset if I get ghosted, but I ghost people every day. Not on purpose.
Yeah.
It's just like, oh my gosh, has it been 3 days since that person emailed me? I feel like it was 10 minutes ago.
Yeah.
It just goes so
And people
fast.
do get upset. And I always say,
I know.
well, first of all, don't leave a voicemail, because who's at their desk looking for that light to light up on your phone?
Right.
But I'm like, call me or email me again. I don't get mad about that.
Yeah, exactly.
I actually have my desk phone that forwards to my cell phone,
Yeah,
and I
that's
know
perfect.
that's a gamble, but
Yeah.
people can get a hold of you.
Absolutely. Well, I'm curious to hear, because I know I got excited when I heard that you teach leadership, and I would love to hear a little bit about what types of topics are top of mind that you are instructing people on, and just demographically, like what are we talking age-wise that these students are typically?
Well, that's a good question. It's really varied.
Okay.
So I mostly have taught graduate students.
Okay.
These past couple of years, I did get involved in an undergraduate course because it's an intro to health administration. It kind of made sense, and I co-teach it with Dr. Eric Carlton, a colleague. And so we tag team it. He's more of sort of an academic, and I'm definitely more of on the professional side. So the undergrads, it's hard because the majority of them have no work experience.
Okay.
And it's just hard to relate to.
Yeah, because it's more
things.
conceptual when you're
Right.
having the conversation.
And I actually enjoy teaching at the graduate level more because I do a lot of applied learning. So if there's something about effective listening, let's say as a management technique, I do talk about rounds in the hospital and all the examples you and I just talked about. So the graduate students are, I find at the MPH level for the public health focus, we do get a lot of kids that go straight through from undergrad to grad.
Okay, so still maybe not really
No.
having any work experience then.
No, and that's a big part of what I've tried to do with my community engagement is make connections with organizations where our students can intern. Yeah, if they could get paid, great. If they can't, it's still an amazing experience.
Yeah.
And I think it differentiates you as a student when you come out and can say, I worked in a physician office clinic or whatever. But our MHA program, we started a master's in health administration a couple of years ago. And that tends to be, we have a residential in-person and we have an online.
Okay.
The online program tends to be people who are definitely in the workforce, older, and are out working. And I can definitely tell a difference sort of in their papers and when they write about issues or think about a case study, just
That's
in the
real
way
life
they're
for them.
thinking. And I know that some of those undergrads, when they leave the classroom, they're not going to, you don't remember it until you're actually on the job. How many times have you looked at your child's homework and been like, I have no idea how to do that? And I can promise you that you will never, ever have to know that in life.
Yes. Well, I always joke around. One of my favorite memes is like, yet another day has passed that I didn't have to use the Pythagorean theorem.
Yes, exactly.
Which I know there's people who use that in their job.
Yeah.
I just don't, because I know my strengths and I know my weaknesses.
There's never been one day where I got out my protractor and had to draw, a circle around
just
it.
So.
Yeah. So I am realistic that they still got to get out there in the workforce.
They do.
But it's interesting because I do try to focus a lot on emotional intelligence.
That's fantastic.
Because I think that I could take anyone into a job and teach them the business. I can't teach them really emotional intelligence and people skills.
Right.
And so there are just some people, and I also talk a lot about that. So like, what are healthcare careers that you talked about? And of course we got off topic because you and I get off topic about everything.
I know, but I love talking to you.
So, but I mean, there are jobs in hospitals where you don't have to be the person in front of everybody walking around. So you could manage IT, and you know, if you like computers, electronic medical records are a huge part of what we do day to day.
Yeah.
So having somebody that necessarily understands the processes and can relate it to a physician clinic is golden. You could run HR, you could do strategic planning, and maybe you're the data person who wants to be behind a computer every day. I kind of thought that's what I wanted to do at first with policy and planning and writing, and it wasn't until I just fell into that off-shift administrator job that I realized, like, wow, I really like operations. But I also tell the students, you will either love operations or you will hate it.
Yes.
There's no in between.
No, and you'll learn that pretty quickly. Yeah, I just think, and I'd like to hear too, just what you're seeing. So it sounds like emotional intelligence, which I love, because I do think, similar to kind of what you're saying, I always tell people, you can be the smartest person in the room, but if you're not able to effectively articulate your ideas, influence, have relationships,
self-awareness,
built, doesn't matter how great that idea is, it's not necessarily going to come to life. So I love that you're teaching that. Are there other gaps that you're seeing from a leadership perspective that you're really trying to focus on with the leadership courses that you are teaching?
Good question. I think emotional intelligence is probably the biggest gap. And I think kids being able to hit the ground running. So I think people have this notion that you're going to go and get a master's degree and that you're going to come out and be the director. And unfortunately, the job market isn't like that anymore.
No.
And so if you could even work in a physician practice while you're doing your degree, let's say I work at the front desk, that would be such a great opportunity because I'm going to learn how to interact with patients. I'm going to learn how a clinic works. I learn how the computer system works, how patients get checked in, how they get checked out, where the copays go. I understand the ramifications of what happens if a patient checks in, but I forgot to check them in on the computer, and then they sat in the waiting room for an hour.
Or 4.
Or 4 hours, and nobody went out and asked them. And so, and I think that helps you later. And I know there are people that have a lot more confidence than I do, but when I went straight through grad school. I did the fellowship, and the fellowship is in the CEO's office. Then I came to Northwestern, and I worked in the CEO's office. It wasn't until I became an off-shift administrator and there aren't a lot of people on nights and weekends, so you're the one they call if there's a problem. And you kind of get to the point where you're like, I have no idea what the answer is, but I'm going to find out.
Right.
And so then you're running all over the hospital, figuring out, because there just aren't a lot of people there on nights and weekends.
You have to learn it yourself.
Yeah. So you can't get a hold of whatever company and this piece of equipment is broken. Well, let me go figure out who to call.
Yeah.
And so I personally gained a lot of confidence doing that because then I figured out how everywhere works and what one area does that negatively impacts another area.
Yeah, how everything's linked, which really helps too, because I think a lot of times you hear about people being very siloed in any kind of organization. And when you have worked in a lot of those different departments, I think it allows you to break down some of those silos and make the connections that other people aren't able to make sometimes.
Yeah. And the other gap that I think, and we're really trying to focus on this with the students, is project management. So I don't know if the students today have a good understanding of how to put a work plan together, and not just a work plan, not just the task. Who's responsible for every item? What's the date it's going to be completed? We can't meet every week and come in and just review the agenda.
Yes.
Like, we really need to say, like, okay, you were going to do that, and that's do this. And what day is this going to be complete? And is it on time? And is it on budget?
Yeah.
So they've got to have those skills.
Yeah.
Because with the economy the way it is and healthcare the way it is, we have a smaller margin. We can't afford to be overstaffed.
No.
And so really, and education's so important. But you also have to understand the practical side of it as well.
Yeah.
So if I have two people that walk in and they both have the same education, but one has done some work, that's the one I'm going to go with.
Absolutely.
Because I know they can hit the ground running,
Yes.
even though that other person might have a ton of potential.
Right. But just that work, there's certain things you can't replace with that work experience, and just the relevancy. It helps you apply all the concepts that you are learning from the classroom and brings everything to life so much better. And then you can everything starts firing, I think, at that point. I remember I had to take an exam for an HR certification, and I did it. You could take it as soon as you graduated with your undergrad, and then you had to work for a few years before you could officially be granted the certification. But I thought, let's just get this test out of the way. I had literally started in my HR career for like 5 minutes. I mean, literally it was, I think, a month. Because, at the end of your schooling, you don't have to go to as many classes and stuff. So I technically started my full-time job. And there were so many questions on that HR examination, that certification, that I already was like, oh, I've done this.
Yeah.
And it really helped me, I think, to pass that test. And even though I'd only worked for a month.
It really does. I couldn't agree more. And I think the last thing in it, and I think you get this when you are out there working, is I always tell students and people, if you're not getting the desired result of what you're working towards, what are you incentivizing them to do?
Yeah.
And so you've got to turn it around to the what's in it for me.
Yes.
So I have to look at you and say, what's in it for her?
Yes.
So is it money? Is it gratitude? Is it, being
Time off.
thanked? Is it time off? Whatever it is. Is it the flex work schedule?
Yeah.
Like, things aren't happening. You're not getting the intended result,
right?
Because of the fact that you're not turning it around and thinking of it that way.
Absolutely, and that's huge.
Yeah, and we talked about kind of management in hospitals, but I think management can be applied everywhere.
I think so. I mean, all of the examples that you've shared, and you said it earlier. I mean, leadership is leadership.
Yeah.
So the things, once you get beyond the basics of day-to-day management, to me, someone's leadership style really becomes very unique to them, which is the whole reason that I do this podcast, is because I want to give people different examples of leaders and how they define leadership in their own terms. And it is above and beyond the basic management skills.
Right.
It's just really, okay, well, how does Sarah show up as a leader? And I'd love to actually, while I'm saying that, why don't I just ask you that question? I mean, what is your definition of leadership in your own words of what it means to be a leader?
So in my own words, I kind of take off of a quote, but I'll try to make it my own. It's really, there's a quote that says, leadership is the art of mobilizing others to struggle for the same aspirations. And let me tell you why I like it. Because I do think leadership's an art. It's not a science.
Yes.
I do think it's about motivating others.
Yes.
And I do think it's a struggle, because if you can't get people to see your same vision, then you're not going in the same direction. Yeah. So you hear, like, if nobody's following you, you're not leading anybody.
Right. That is an important point.
It's a very important point. If nobody's following you, you're actually just taking a walk.
By yourself.
By yourself. You're on a solo walk.
Following you is your shadow.
Yeah. And, when that disappears.
Exactly.
So I just really like that quote. And I try to say it because I'm like, it's an art. It is not a science. There's not one formula. You have to motivate others. You have to show them the vision of where we're headed. If I just come in one day and say, hey, I know you've been doing it this way for 20 years, but now I want you to do it this way, and I don't explain why, you're just sitting there thinking like, well, she's lost her mind and I'm not doing it that way. And now I'm just annoyed. I'm gonna quit.
She's just wasting my time.
Now I'm going to quit because this isn't what I signed up to do. But if we sit down and talk about like, well, the healthcare industry's changed and this is why we need to do this. And now more people are going to urgent care than they are to the emergency room, for example, because we have more access to urgent care and we took urgent care out to the community.
Right.
Instead of making you come to Morgantown and go to the emergency room.
Exactly.
So, so making them understand the why. So I do. I think it's, motivating others. I think it's you have to struggle to get them there, and you have to have shared aspirations. They can't be your aspirations. They have to be shared.
Oh, that is good. I like that one. Yeah, that's a good one. And I like how you made it your own, even though it's a
it's somebody else's quote, but I just like it because it has like so many pieces of it that you can pick out.
Yeah. So while we were talking a little bit ago, I looked at the clock and I was like, oh my gosh,
I know,
we haven't even scratched half of the things I wanted to talk to you about. So 2 things. Number 1, can you come back for another episode?
Heck yeah.
Yes. Okay. And then we'll wrap this one for now. But my last question to you is, you were talking about legacy earlier, and I am really passionate about leadership legacy. So I just thought a nice way to maybe round out today's discussion before we have you back again is to say, what do you want your legacy to be, especially from a leadership context?
So that's a good question. So one of my role models was Bill Neal. I don't know if you know Bill Neal. So Dr. Neal, near and dear to my heart, was family. I grew up right next to them, and he was just a role model for me and somebody that I worked with a lot when I came back here. And as you know, Bill passed away a couple years ago, and it was way too soon, but Bill really left a legacy, and he and I talked a lot. Everyone knows Bill knew he was a talker, but we used to talk a lot about kind of what we wanted to achieve and what we wanted people to remember us by. And Bill was passionate about helping the kids in the state of West Virginia. He's Pete's heart doctor, and he literally made a difference where it took, I think his cardiac project went for 18 years, and in that 18 years, he flattened the obesity rate in the state of West Virginia. Flattened.
Wow.
Didn't necessarily take it in the other direction.
Right.
But that was through grants and fundraising and tireless work to get nurse practitioners out into every county and to be testing the blood of every 5th grader in the state of West Virginia. And so 18 years, that didn't happen quickly.
No.
And so I just think it really made me, and especially when Bill passed away, it made me really think about, like, I want to make other people's lives better. And I truly feel if you can't get passionate about the public health issues in the state of West Virginia, you can't have a passion about anything.
No.
I mean, you really can't.
There's a lot of opportunity and places that you can get passionate about and make a difference.
And there's so many people, and I think you have to do it one at a time.
And when you were talking about the 18 years, I got chills because that is a long time.
Yeah, and he wasn't every year like, woo, look at these results. Like, I think I'm just going to keep going.
They're the same as last year. Awesome.
Obesity's still a huge problem. And unfortunately, we change our perspective when we're comparing ourselves with Mississippi and Kentucky.
Yes.
But, I mean, he saw a vision, and he knew it was the right thing to do, and he's passionate about the state of West Virginia. So
That's
anyway,
amazing.
I could only hope that my legacy would be as good as his.
That's a good aspiration, though, and I know that you are well on your way based on all the work that you are doing.
Thanks. I hope so.
Thank you. Thanks for being here today.
Thank you. Time flew by.
Oh my gosh.
You're dangerous to talk to.
You are. But I'm glad you're coming back now. Before we close, can we do the lightning round?
Okay, I'm going to try.
A game. Okay. 60 seconds to answer as many.
Okay, if I don't know, can I say pass?
Yes. I mean, there are questions about yourself, but yes, you can still pass.
I have no idea. Pass.
Okay. On your mark, set, go. What season best fits your personality?
Fall.
Okay.
What's
your most used emoji in text?
Oh, the one where she's crying laughing.
Yeah,
I don't know if it was a she, but I made it a she.
Yeah, well, yeah, makes sense. What book, song, movie, or podcast has had the greatest impact on your life?
Probably Untamed has had the biggest impact.
Yes. Okay.
I do like James Patterson.
We need a whole sidebar.
Yeah,
on
we
Untamed.
do.
What's something about you that surprises people when they first hear it?
That on the Myers-Briggs, I'm actually a borderline introvert extrovert.
I could see that. Okay.
So we could talk about that.
Yeah,
another
we can
time.
talk about that too. All right. This is going to be good. Fill in the blank. I spend too much money on
My kids.
Yeah.
Yeah. Travel volleyball.
Oh, gosh. Yeah. Travel sports are a lot. What celebrity would you want to play you in a movie?
I might have to think about that one.
Yeah.
I've never thought about it.
Yeah. I feel like Kate Beckinsale would be a good
Would that be a good
choice
one?
for you? Yeah. She would be a good choice. Okay.
Yeah.
That went fast too.
Yeah. Was that a minute?
Yes.
I have so much more I want to say.
But the good news is I have so many more questions. But now that I've agreed to have you back, then we can finish with that. Which
and
I've
now
had
that I've
repeat
been
guests.
here and you're not scary and it wasn't scary,
I
so
know.
we
I
can
know.
do
I
it.
am a really intimidating person.
You
So I'm
are.
glad you've learned that I'm not.
Definitely.
Actually. Thank you so much.
Thank you for
being
asking
here.
me to be here.
This
I enjoyed
was amazing, and it exceeded my very high expectations that I've had
Good.
for you and built for you. So
Good.
thank you.
All right. Well, I look forward to doing it again.
Me too.
And some talks offline.
Yeah, many of those over cocktails. Well, that's all the time we have for today, folks. Until next time, shine bright, everyone.